Hi, today we're diving into a topic that is both fascinating and terrifying. We'll be discussing the rare but real instances where surgeries have gone horribly wrong, leading to life-altering consequences. We put a lot of trust in medical professionals, especially when it comes to surgery. These highly trained individuals are responsible for our lives when we're most vulnerable. Their expertise and precision are crucial in ensuring successful outcomes. But the reality is, sometimes things go terribly wrong. Despite their expertise, unforeseen complications can arise, leading to disastrous outcomes. These complications can range from minor issues to catastrophic failures that can change lives forever. In this video, we're going to explore some truly shocking, real-life surgical disasters. These are not just stories. They are real events that have had profound impacts on patients and medical staff alike. We'll delve into the details of each case to understand what went wrong and why. We'll break down what happened, who was responsible, and the far-reaching consequences. From misdiagnoses to surgical errors, we'll cover it all. Each case will provide valuable insights into the complexities and risks involved in surgical procedures. Get ready, because some of these stories are truly disturbing. Let's dive in and uncover the truth behind these medical nightmares. By understanding these events, we can better appreciate the challenges faced by medical professionals and the importance of continuous improvement in the field of surgery. Imagine this. You go in for a routine knee surgery, a procedure that is supposed to be straightforward and low risk. You trust the medical team, believing that you are in capable hands, and you expect to come out of the surgery with your knee fixed and your pain alleviated. It's a procedure performed countless times a day in hospitals around the world. It's a common operation, one that many people undergo without a second thought, trusting the expertise of their medical team. The process is usually seamless, with the patient waking up post-surgery ready to start their recovery. You wake up expecting to be on the road to recovery, looking forward to getting back to your normal life, free from the pain that brought you to the hospital in the first place. The relief of knowing the surgery is over, and the anticipation of healing fills you with hope. Only to discover the unthinkable: the surgeon operated on the wrong knee. The shock and disbelief are overwhelming, leaving you to grapple with the reality of a medical error that should never have happened. The emotional and physical toll of such a mistake is unimaginable. This nightmare scenario became a reality for John Harrison in 2007. John, like many others, trusted the medical professionals with his care, believing he was in safe hands. He had no reason to doubt the competence of the team responsible for his surgery. John was scheduled for surgery on his right knee, a procedure he had been assured was straightforward and low risk. The goal was to repair a torn meniscus, a common injury that affects many athletes and active individuals. The surgery was supposed to be a routine fix to get him back on his feet. It was supposed to be a simple procedure to repair a torn meniscus, something that would alleviate his pain and improve his mobility, allowing him to return to his active lifestyle. The expectation was a quick recovery and a return to normal activities. However, somewhere between the pre-op room and the operating table, a critical error occurred. The meticulous planning and preparation failed to prevent a grave mistake, one that would have lasting consequences. The system that was supposed to protect him failed in a fundamental way. The surgical team, in a shocking breach of protocol, overlooked the essential step of verifying the correct surgical site. This oversight was a catastrophic failure in the system. The lack of proper checks and balances led to an avoidable error. They failed to properly mark the correct surgical site, a fundamental step in ensuring patient safety. This simple yet crucial step could have prevented the entire ordeal. The absence of this verification step was a glaring omission in the surgical process. Hospitals have strict pre-operative checklists designed to prevent these exact situations. These checklists are a critical part of surgical safety protocols, meant to catch any potential errors before they occur. They are designed to ensure that every step is followed meticulously. But in John's case, these critical steps were missed or ignored. The oversight led to a devastating outcome, one that would haunt him for years to come. The failure to adhere to these protocols resulted in a preventable tragedy. John underwent an unnecessary and invasive procedure on his perfectly healthy left knee. The error not only caused physical harm but also emotional trauma, leaving him to deal with the aftermath of a preventable mistake. The impact on his life was profound and far-reaching. He endured weeks of pain, rehabilitation, and emotional distress. The road to recovery was long and arduous, filled with frustration and setbacks, as he worked to regain his strength and mobility. The journey was not just physical, but also a mental and emotional battle. John sought legal action against the surgeon and the hospital. The legal battle was a necessary step to seek justice and accountability, highlighting the need for systemic changes in surgical practices. The case brought to light the importance of legal recourse in medical malpractice. The case highlighted the dangers of complacency and the importance of adhering to safety protocols. It served as a wake-up call for the medical community, emphasizing the need for constant vigilance. The incident underscored the critical nature of following established procedures. It forced a re-evaluation of surgical safety procedures nationwide. Hospitals and surgical teams had to reassess their protocols to prevent such errors in the future, ensuring that no other patient would suffer the same fate. The changes aimed to enhance patient safety and trust in the medical system. John's case became a textbook example of how quickly a routine surgery can go wrong. It underscored the need for vigilance and strict adherence to safety measures in every surgical procedure, serving as a crucial lesson for the entire medical field. The story serves as a reminder of the human cost of medical errors and the importance of continuous improvement in healthcare practices. Plastic surgery, once a luxury for the wealthy, has become increasingly common, with millions of procedures performed annually worldwide. From facelifts to tummy tucks, the industry promises to enhance beauty and boost self-esteem. But any surgery carries inherent risks, including infection, complications from anesthesia, and unexpected surgical errors. These risks can lead to severe health issues, prolonged recovery times, and even life-threatening situations. In 2013, aspiring model Olivia Taylor learned this the hard way when a routine nose job, intended to boost her confidence and career, turned into a nightmare. What was supposed to be a simple procedure became a life-altering event. Olivia had always been self-conscious about her nose and selected a clinic with a seemingly reputable surgeon who had glowing reviews and a polished website. She believed she was in safe hands, trusting the clinic's professional appearance. But behind the polished facade lay a history of malpractice, with several previous patients having filed complaints and lawsuits. These red flags were hidden from public view, leaving patients like Olivia unaware of the potential dangers. During the procedure, the surgeon severed a major blood vessel, a mistake that could have been avoided with proper care and attention. This critical error led to a cascade of complications that the surgical team was ill-prepared to handle. Olivia began bleeding profusely, and the surgical team panicked, lacking the necessary experience to handle such a critical situation. The operating room descended into chaos as they struggled to control the bleeding. By the time they stabilized her, the damage was done, leaving her with severe complications that would affect her for the rest of her life. The aftermath of the surgery was a stark contrast to the hopeful expectations Olivia had. Olivia had suffered severe blood loss, leading to permanent brain damage, a devastating outcome for someone so young and full of potential. Her dreams of a modeling career were shattered, replaced by a long road to recovery. The clinic tried to downplay the incident, but Olivia took her story public, determined to prevent others from experiencing the same fate. Her bravery in speaking out brought much-needed attention to the issue of surgical malpractice. The ensuing media storm forced authorities to investigate, uncovering a pattern of malpractice and negligence that had been hidden for years. The investigation revealed systemic issues within the clinic that had been overlooked. The clinic faced massive fines and the surgeon was stripped of his license, a small consolation for the lives that had been affected. The closure of the clinic marked the end of a dangerous chapter in the medical community. Olivia's story became a cautionary tale, urging prospective patients to thoroughly vet surgeons, check their credentials, and seek multiple opinions before undergoing any procedure. Her experience serves as a powerful reminder of the importance of due diligence in medical decisions. Anesthesia allows us to undergo complex procedures without pain, making surgeries and other medical interventions possible without the agony that would otherwise accompany them. It is a cornerstone of modern medicine, enabling doctors to perform intricate operations that save lives and improve the quality of life for countless patients. The development of anesthesia has revolutionized the medical field, transforming once impossible surgeries into routine procedures and significantly reducing patient mortality and morbidity rates. But what happens when that trust is shattered? When the very thing meant to protect us becomes a source of harm? The consequences can be devastating, leading to tragic outcomes that leave families and communities in mourning. The ripple effects of such incidents extend far beyond the operating room, affecting everyone involved, from the medical staff to the patient's loved ones, and even the broader community. This is the heartbreaking story of 8-year-old Sophie Mason, who tragically died due to a fatal anesthesia overdose during what was supposed to be a routine dental procedure. Her story is a stark reminder of the potential dangers that can arise when medical protocols are not followed meticulously. Sophie's case underscores the importance of vigilance, precision, and adherence to established guidelines in every medical procedure, no matter how minor it may seem. Sophie needed some dental work and was scheduled for a minor procedure, something that should have been straightforward and safe. Her parents had no reason to worry, trusting that the medical professionals would take good care of their daughter. They had done their research, chosen a reputable clinic, and believed they were in good hands, never imagining the nightmare that would unfold. The anesthesiologist, tasked with administering the anesthesia, seemed competent and experienced, someone you would trust with your child's life. He had performed similar procedures countless times before, always with successful outcomes. His credentials were impeccable, and he was well respected among his peers, making the subsequent events all the more shocking. But he was exhausted, having worked long hours without adequate rest, a common issue in the medical field. Fatigue can impair judgment and lead to mistakes, even among the most skilled professionals. The pressures of the healthcare system often push medical staff to their limits, creating an environment where errors become more likely. In his fatigued state, he miscalculated the dosage, administering a dose far exceeding the safe limit for a child of Sophie's size and age. This critical error set off a chain of events that would end in tragedy. The miscalculation was a result of a momentary lapse in concentration, a small mistake with catastrophic consequences. Sophie went into cardiac arrest almost immediately, and the surgical team frantically tried to revive her, doing everything in their power to save her young life. Despite their best efforts, the damage was too severe. The team worked tirelessly, employing every technique and resource available, but the overdose had already caused irreversible harm. But it was too late. The overdose had caused irreversible damage, and Sophie passed away, leaving her family devastated. The loss of a child is an unimaginable pain, one that no family should ever have to endure. The emotional toll on her parents, siblings, and extended family was profound, altering their lives forever. The investigation that followed revealed a systemic problem within the hospital, a culture that prioritized efficiency and speed over patient safety and proper care. This culture of overwork and haste had dire consequences. The findings highlighted the need for systemic changes to prevent such tragedies from recurring, emphasizing the importance of a balanced approach that values both efficiency and safety. Sophie's tragic death sparked outrage in the community and led to calls for stricter regulations and oversight in medical practices. People demanded accountability and changes to prevent such tragedies from happening again. The public outcry was a powerful force, driving legislative and institutional reforms aimed at enhancing patient safety. Hospitals were forced to reevaluate their scheduling practices, ensuring that medical professionals were not overworked and that patient safety was the top priority. New policies were implemented to address the root causes of such errors. These changes included mandatory rest periods, better staffing ratios, and enhanced training programs to ensure that all medical staff were well prepared and alert. Sophie's story served as a catalyst for change, highlighting the critical importance of patient safety and the need for systemic reforms in healthcare. Training programs were updated, and new safety protocols were introduced. These reforms aim to create a safer, more reliable healthcare system, where the well-being of patients is always the foremost concern. Her legacy lives on in the countless lives saved by hospitals that learned from this tragedy, ensuring that such a heartbreaking incident never happens again. Sophie's memory continues to inspire efforts to improve patient care and safety across the medical field. Her story is a poignant reminder of the human cost of medical errors and the ongoing need for vigilance, compassion, and commitment to excellence in healthcare. Organ transplantation is a beacon of hope for patients with failing organs. It offers a second chance at life, a new beginning for those who have been battling chronic illnesses. The anticipation and relief that come with the news of a matching donor can be overwhelming, filling patients and their families with hope and gratitude. This life-saving procedure has evolved over decades, with advancements in medical technology and surgical techniques making it more successful and accessible than ever before. The journey from diagnosis to transplant is often long and arduous, involving numerous tests, consultations, and waiting periods, but the promise of a new lease on life makes it all worthwhile. But this complex procedure hinges on ensuring the donated organ is a perfect match. The compatibility between donor and recipient is crucial, involving meticulous cross-checking of blood types, tissue types, and other vital factors. Any oversight can lead to catastrophic consequences. The process involves a series of checks and balances, including laboratory tests, imaging studies, and consultations with multiple specialists to confirm the match. Each step is designed to minimize the risk of rejection and maximize the chances of a successful transplant, making the coordination and communication among medical teams absolutely essential. In 2018, Daniel Roberts became the victim of an unthinkable error, an organ transplant mix-up that cost him his life. His story is a tragic reminder of the fallibility of even the most advanced medical systems. Despite the rigorous protocols in place, human error can still infiltrate the process, leading to devastating outcomes for patients and their families. Daniel's case underscores the importance of vigilance and the need for continuous improvement in medical practices to prevent such tragedies from occurring. Daniel had been battling kidney disease for years, and finally received the call that a matching kidney was available. The news brought immense relief and joy to him and his family, who had been anxiously waiting for this moment. The call signified the end of a long and arduous journey filled with hospital visits, dialysis sessions, and the constant uncertainty of his health. For Daniel, this was not just a medical procedure. It was a lifeline, a chance to reclaim his life and future. The transplant team assured Daniel and his family that the surgery was routine. They were confident in their skills and the procedures in place, having performed countless successful transplants before. The team included some of the best surgeons, nurses, and support staff, all dedicated to ensuring the best possible outcome for their patients. Their confidence was based on years of experience and a deep understanding of the complexities involved in organ transplantation. But behind the scenes, a fatal error was already in motion. The hospital's bustling environment and the high-pressure nature of transplant surgeries can sometimes lead to lapses in communication and protocol. The complexity of coordinating multiple departments and ensuring every detail is accounted for can create opportunities for mistakes. In Daniel's case, the high-stress environment contributed to a series of miscommunications that would ultimately prove fatal. The organ's vital information was miscommunicated, and the surgical team failed to double-check its compatibility. This oversight set the stage for a tragic outcome. The error could have been caught at several points, but a series of missteps and assumptions led to the fatal mistake. Each missed opportunity to correct the error compounded the risk, ultimately leading to a catastrophic failure. Daniel went into surgery, unaware that the kidney was not a match for his blood type. The excitement and hope he felt were soon to be replaced by unimaginable pain and suffering. The surgery, which was supposed to be a life-saving procedure, turned into a nightmare as his body began to reject the organ. The initial signs of rejection were subtle, but they quickly escalated into a full-blown medical crisis. His body immediately began to reject the foreign organ, leading to a cascade of complications. The medical team was caught off guard, scrambling to manage the unexpected crisis. Despite their best efforts, the situation quickly escalated, with Daniel's condition deteriorating rapidly. The team tried various interventions to stabilize him, but the rejection was too severe and unrelenting. The medical team fought desperately to save Daniel, but the damage was irreversible. Despite their best efforts, the situation spiraled out of control, and Daniel's condition rapidly deteriorated. The team tried multiple interventions, but the rejection was too severe, and they were unable to stabilize him. The emotional toll on the medical staff was immense, as they grappled with the realization that they were losing their patient. The investigation revealed a series of failures that ultimately cost him his life. Each step of the process was scrutinized, uncovering multiple points where the error could have been caught and corrected. The hospital conducted a thorough review, identifying gaps in their protocols and communication channels. The findings highlighted the need for more stringent checks and a culture of accountability to prevent such errors in the future. Daniel's case exposed the vulnerability of even the most sophisticated systems to human error. It highlighted the need for more robust safeguards and checks to prevent such tragedies. The findings prompted a re-evaluation of existing procedures and the implementation of new safety measures to protect future patients. The hospital's response included upgrading their computer systems, enhancing staff training, and introducing more rigorous verification processes. It led to a complete overhaul of organ transplant protocols nationwide. Hospitals implemented stricter verification processes, additional training for staff, and improved communication channels to ensure such a mistake would never happen again. The changes aimed to create a more fail-safe system, reducing the risk of human error and enhancing patient safety. These reforms have since been credited with improving the overall success rates of organ transplants and restoring public trust in the medical system. Daniel's story serves as a cautionary tale, highlighting the importance of meticulous attention to detail. It reminds us that in the world of medicine, where lives hang in the balance, there is no room for error. His legacy has driven significant improvements in medical practices, ensuring that his tragic experience will help save countless lives in the future. The lessons learned from his case continue to influence medical protocols and inspire a commitment to excellence in patient care. Spinal surgery requires the utmost precision and expertise. Surgeons must navigate the complex anatomy of the spine, avoiding critical nerves and blood vessels. Any misstep can have severe consequences, making the procedure one of the most challenging in the medical field. When performed correctly, it can alleviate debilitating pain. Patients often experience significant improvements in their quality of life. Successful spinal surgeries can restore mobility and allow individuals to return to their daily activities with renewed vigor. But when things go wrong, the consequences can be catastrophic. Errors can lead to permanent damage, chronic pain, or even paralysis. The stakes are incredibly high, and the margin for error is virtually non-existent. In 2019, Linda Matthews underwent spinal surgery that left her paralyzed due to a surgeon's egregious error. The mistake altered her life forever. Linda's case became a stark reminder of the potential dangers inherent in complex surgical procedures. Linda had suffered from back pain for years and decided to undergo spinal surgery. She hoped the procedure would bring her much-needed relief. Her decision was driven by the desire to reclaim her life and escape the constant pain that had plagued her. The surgery began without a hitch, but then the unthinkable happened. A critical error occurred during the procedure. The operating room, once a place of hope, quickly turned into a scene of irreversible tragedy. The surgeon misplaced a metal implant, piercing Linda's spinal cord. This mistake caused severe and immediate damage. The error was a devastating blow, shattering the promise of a pain-free future. The damage was immediate and irreversible. Linda's spinal cord was permanently injured. The realization of the extent of the damage was a harrowing moment for everyone involved. Linda awoke from surgery paralyzed. The realization was devastating for her and her family. The dreams of a pain-free life were replaced with the harsh reality of permanent disability. The hospital launched an internal investigation and discovered a lack of oversight in complex procedures. This oversight failure contributed to the tragic outcome. The investigation revealed systemic issues that needed urgent attention. Linda became a fierce advocate for patient safety, demanding accountability from the hospital and the surgeon. She spoke out to prevent similar incidents from happening to others. Her advocacy efforts aimed to bring about meaningful change in the medical community. Her case spurred hospitals nationwide to reevaluate their safety protocols. Institutions began implementing stricter measures to ensure patient safety. The ripple effect of her story led to widespread reforms in surgical practices. It led to stricter training requirements for surgeons and increased oversight in operating rooms. These changes aimed to reduce the risk of surgical errors. The medical community recognized the need for continuous improvement in surgical standards. Linda's story became a catalyst for change, highlighting the devastating consequences of surgical errors. Her advocacy brought attention to the need for improved medical practices. Her courage and determination inspired a movement towards safer surgical procedures. These stories highlight the very real human cost of surgical errors, showing how even minor mistakes can lead to devastating consequences for patients and their families. From misdiagnoses to surgical instruments left inside the body, the range of errors is vast and often heartbreaking. They serve as a stark reminder that even in this age of advanced medical technology, things can and do go wrong, often due to human error, equipment failure, or unforeseen complications. Despite the best efforts of medical professionals, the complexity of surgeries means that risks are always present. But these stories also offer a glimmer of hope, illustrating the resilience of patients and the dedication of medical professionals to improve outcomes. Many patients go on to lead fulfilling lives, thanks to the relentless efforts of healthcare teams who learn from past mistakes and strive for better care. They have sparked outrage, fueled investigations, and led to meaningful changes in hospital protocols and safety regulations, aiming to prevent such tragedies in the future. Hospitals are now more vigilant, implementing stricter guidelines and continuous training to minimize errors. Always ask questions, research your provider, and advocate for your care. Being informed and proactive can significantly reduce the risk of medical errors. Understanding your treatment options and knowing the right questions to ask can make a huge difference in your healthcare experience. If you found this video helpful, please like, share, and subscribe. Your support helps us continue to bring important stories to light. By spreading awareness, we can collectively push for better healthcare standards and practices. Have a story to share? Let us know in the comments below. Your experiences can help others navigate their own healthcare journeys. Sharing your story can provide comfort and guidance to those who may be facing similar challenges.